Live from Toledo, 13 Action News starts now.
A bipartisan message from Ohio and Massachusetts senior senators urging their colleagues to save Social Security. This comes as older adults on fixed incomes are being squeezed by higher prices and changes to legislation. The future of retirement is our big story today. Earlier today, Republican Senator Bernie Moreno of Ohio and Democratic Senator Elizabeth Warren of Massachusetts published a bipartisan op-ed in the New York Times. It was an outline of their plan for saving Social Security. The op-ed advocates for lifting the Social Security payroll tax cap. According to Senators Moreno and Warren, the 2026 payroll tax cap, or the taxable maximum, is $184,500. But the Social Security Administration reports most Americans make less than that, meaning most people are paying Social Security taxes on all of their earnings. Moreno and Warren cited data from the Peter G. Peterson Foundation, which estimates that eliminating the payroll tax cap would add $3 trillion into the program over the next 10 years. Meanwhile, a 2025 study from Bankrate found 52% of Americans expect to rely on Social Security benefits when they retire. And 4 out of 5 currently retired individuals say they're relying on the program to pay their necessary, not luxury, expenses. Now, we all contribute to Social Security with every paycheck, but questions about the program's funding in the future, they've been swirling for years, and fears that Social Security is running out of money have some beneficiaries rushing to claim early. But experts say that panic might actually cost you in the long run.
For most people who are working, their full retirement age is 67. If you claim Social Security before that and you're still earning income, you could have to give back some of your benefits.
Meanwhile, another plus to waiting here, you lock in a higher monthly payment and get an extra boost from inflation adjustments. But financial struggles are prompting more and more retirees across the nation to re-enter the workforce. A recent survey shows about 1 in 8 seniors are either returning to work or planning to do so this year. And AARP finds 7% of retirees have re-entered the workforce in the past 6 months. That's up 6% from just last year. One retiree from East Texas who lives alone says making ends meet seems almost impossible.
We're paying higher prices at the gas pumps more than anything. The foods that we were used to buying, we can't afford anymore. Electricity bill, I mean, it's outrageous.
Meanwhile, earlier today, city and state leaders gathered ahead of a 1-year anniversary of the passing of the One Big Beautiful bill. Those leaders saying 180,000 people will lose health care coverage because of that law, specifically the new Medicaid work requirements, which we've previously talked to you about. A Democratic State Representative, Erica White, says she's received calls from some constituents about how the law has impacted them. That includes one woman who White says was receiving Social Security disability insurance and Medicaid for help.
And she's going to become homeless because trying to decide what to pay. Am I going to pay for food? Am I going to pay for the cost of my house? Am I going to pay for medicine? And those cuts are really hitting home.
Now, State Representative White echoed what we heard earlier, that older adults are having to return to work due to those rising costs. Now, according to Schroeder's 2026 U.S. retirement survey, 49% of retirees report that their expenses in retirement are actually higher than they expected. And more than half say they don't know how long their savings will last. On average, retirees report spending 16% of their total monthly income on health care. Those include insurance premiums, prescription costs, and out-of-pocket expenses. The survey also finds the majority of those retirees say they expected Medicare to cover a greater share of their health care costs. Meanwhile, health care affordability appears to be an issue that could impact the midterm elections. About 45% of respondents in an Axios Ipsos poll says they're more likely to vote for a candidate who supports reviving enhanced Obamacare subsidies. Axios says political views are a factor here, but the respondents were not strictly along party lines. Ipsos' vice president notes the numbers show Americans want the government to help them pay less for health care. Meanwhile, for Toledo's growing senior population, high prices could mean choosing between health care costs and other bills like rent. A new apartment complex in the Junction neighborhood hoping to change that. Collingwood Green Living opened late last month. The 75-unit apartments is for adults 62 and older. Lucas Metropolitan Housing says it's invested more than $100 million over the last 2 years in similar projects.
We care about Junction, right, the Junction area, and that we want to put more resources into the Junction area and other areas, quite frankly. But for the city, what it means is we're trying to meet demand. We're trying to make sure that the demand for housing is critical right now. It's high. It's at probably its highest level, affordable housing, quality affordable housing. And we're meeting that demand by putting up units like this.
Meanwhile, work on the McClinton Nunn Homes, another LMH project, will start later this fall. That building set to get a $10 million facelift. So if you want to stay in the know with what's happening with Social Security and the impacts that legislation could have on you and your wallet, download the all-new 13 Action News app. It's available in your phone's app store.